Here's a scenario every experienced nurse has lived through. A patient on a med-surg floor. Over 8 hours, her heart rate climbs from 82 to 104. Her blood pressure drifts down about 18 points from baseline. Her urine output for the whole shift is only 140 milliliters, and she's just not herself. She barely touched her lunch, and the CNA says she seems tired. No single number crosses a threshold. No alarm fires. No policy says to call. And at 11 p.m., she's found unresponsive. Septic shock. 10 days in the ICU. She survives, but she's never quite the same. And here's what keeps me up at night. The nurse caring for her wasn't negligent. She was looking. She was documenting. She was doing everything she was taught. So why didn't she see it? Because we trained her to read numbers. We never taught her to read patterns. And the evidence is unambiguous. Research on in hospital cardiac arrest shows that as many as 80% of patients have documented signs of deterioration in the 24 hours before they arrest. The warning was there, it was real, it was charted. It just wasn't recognized because in isolation, it never looked like a warning. We teach students normal ranges. We teach them what sepsis looks like, the textbook case, the criteria in the protocol. What we rarely teach them is how to read a pattern across multiple systems at once and recognize it for the emergency it is. The gap has a name. I call it the multi-system signature principle. And here it is stated simply. A single abnormal finding is a data point, but several systems changing at the same time, all pointing to the same cause, that's a signature. One physiologic event showing up in system after system. When the heart rate rises, blood pressure falls, urine output drops, and the patient goes quiet, these aren't four separate findings to check against four normal ranges. They're one signature. The whole body compensating for a single threat, all of them pointing to the same cause, because every system is responding to the same event. The nurse who sees four data points will chart four data points. The nurse who sees one signature will call for help. Here's what makes early deterioration so dangerous. It moves through phases, and in phase one, compensation, the body is still managing. Heart rate climbs, vessels clamp down, blood shunts to the vital organs, and the blood pressure, often still normal. That's the cruelest part. The one number we've trained nurses to treat as the urgency indicator, blood pressure, is usually the last to fall. The body protects it. So while that number looks fine, every other system is already sounded the alarm. A rising heart rate, falling urine output, skin beginning to change, a behavior shift the family notices before the chart does. Those aren't warning signs for later. They are the emergency. As the one phase where nursing can still change the outcome. Let me show you what this looks like. Two nurses, same post-op patient. A bowel resection 2 days ago. Nurse A sees a blood pressure of 102 over 66. Technically acceptable. Heart rate 104. Elevated, but not alarming. Skin a little pale and cool. Urine output 18 milliliters this hour. She documents it all accurately and moves on. Nurse B sees the same numbers and asks a different question. Which systems are changing at the same time right now? And what single cause would explain all of them at once? Cardiovascular, tachycardia, falling pressure, renal, urine dropping, perfusion, pale, cool skin. Three systems all pointing to the same cause. She calls. It's phase one hemorrhagic shock from an anastomotic leak. He survives with a good outcome. Same patient, same data. The only difference was the cognitive tool each nurse brought to it. And this is the teaching problem before it's a practice problem. Only about 9% of new graduates are rated practice ready. 9%. That's down from 23% a decade earlier. And nearly 1 in 3 struggle to recognize when a patient is becoming urgent. That's the signature recognition gap at scale. We won't fix that with better protocols alone. We fix it in the classroom by teaching 2 questions until they fire automatically before assessment even begins. Which systems are changing at the same time? And what single cause would explain all of them at once? Your patients are already sending the signal. The only question is whether the nurse at the bedside has been taught to read it. So, are your students being trained to chart isolated findings or to recognize the signature of deterioration before it becomes a crisis? Visit lifebeatsolutions.com. Thanks for watching.